Yes, this is 2 years in the making, so I'm not kidding when I say I can hardly believe he's here. I've known Anthony for over 10 years, and I've enjoyed every minute. I've worked alongside him. I've also enjoyed some really good pork during my 2 visits to Uganda, and it's been really nice to have him here in the office this week. Anthony is extraordinarily good at what he does. As is Peter. Welcome, welcome. And I know you're going to enjoy their conversation, so please join me in welcoming Anthony and Peter to the stage.
Before we get started, many of you know that Betsy has been around Give Us Wings, I think since she was 4 years old is when she's dubbing. But for a while, she was not paid, and then we decided to start paying her. We started paying her as an actual employee 10 years ago today. Did you know that? So, thank you for all of your service. You're given so much to Give Us Wings over the years, so congratulations. All right. It is my pleasure to be up here with Anthony to share some stories and some information and ask some questions and learn more about you, Anthony, and about the work that you do with Give Us Wings over in Uganda. So first of all, let's just get to know you a little bit better. You were born actually in Kenya, is that correct?
That is correct, Peter.
Can you give us a little bit of a history and how did you end up in Uganda? And then how did you become connected with Give Us Wings?
Okay, so I moved in Uganda 2003, and how that happened was that my dad, he was working as a principal in one of the biggest technical institutes in Tororo, and so he came to Uganda in the early 90s, and he fell in love with Uganda, and he decided that he needed to have me here in Uganda with him. And so 2003, I came from my high school. That's just about it. How I got involved with Give Us Wings was immediately after I completed my university education in 2012. My mom had a friend who connected us to Give Us Wings. So I came to the Give Us Wings office, met the manager at that time, and she accepted me to start as a volunteer. So I volunteered, and I have held several positions. And right now, I work as a program manager for health. Right. That has been my journey with Give Us Wings.
Right. And we're so happy to have you. So you're our health program manager. What are your duties in that job? What does a typical day look like?
So as a program manager, one of my duties is to provide leadership support to the health program, foster partnership with different stakeholders, government institutions, organizations of like mind, and also as well, most importantly, the communities. I also make sure that the health facility is self-sustainable, but also as well, I engage and enhance and encourage innovation among us, the staff, so that we are effective. We are an effective health center, but also as well an efficient health center.
Yeah. And you're part of our management team. So that's made up of 4 managers. We've got the health manager, education, economic development, and then a manager in charge of admin and finance. So as a part of that management team, what do you do?
Okay, so first of all, I want to say that Give Us Wings is blessed to have a very good leadership team here in the US and also in Uganda. So here in the US, we have the dynamic duo, that is Peter and Betsy.
The dynamic duo. Wow. Okay.
While in Uganda, we have the Fantastic Four. That is Winnie, Grace, Paul, and myself. And so this team of 6, think tank, They are charged with the responsibility of ensuring that, the organization is effective, the resources that we receive, trickles down to the community, and the impact that, is felt is far and wide. Aside from that, I perform human resource functions. I write funding proposals. I meet stakeholders. I also work with the National Advisory Team, taking minutes and many other functions.
Right.
Peter.
Right. That's great. So as we heard earlier on the video, St. John's Kaioro Health Center was built in response to the community as saying that we just don't have a good healthcare facility anywhere near us. So given tonight's theme of healthy communities, healthy world, what can you say has happened in your time over the past 10 years or so that has shown that the Kaioro community is getting healthier?
Mindset change has been the biggest thing that has, is the biggest example that we are seeing of our communities getting healthier. Over 10 years ago, we had challenges. First of all, over 10 years ago, the situation was very, very bad. And, there were unconventional practices like, giving birth through the hands of traditional birth attendants who are using very crude methods like razor blades, which would run the risk of infection like HIV, and even the risk of the infant dying and also the mother dying. There were unorthodox and non-scientific methods that were being used to provide treatment options for the people. Self-medication was a menacing problem. People do not want, buying medicines over the counter and then treating themselves without proper prescriptions, therefore enhancing, the disease burden that they had. Pregnant women argued that there is no need to come to the health center for antenatal care because pregnancy is not a disease. We also had high disease burden in the communities. Looking at the data that we had back then, you'd find one client coming into the facility with 3 diseases, very major diseases: malaria, syphilis, for example, and then, maybe a skin infection. So in essence, or in short, people were dying of preventable diseases in the magnitudes.
Right. So that was 10 years ago. So where are we now? What have we seen?
Right now, good things are happening. We are seeing voluntary testing services. They have gone up. We now have hundreds of people coming in to seek for medical attention. The health-seeking behavior has greatly improved. People are voluntarily coming to St. John's to seek various services: antenatal care, childbirthing services, treatment services, and many others. We are witnessing a reduction in the disease burden. So these days we have one client coming in with one disease to treat. And sometimes we are seeing one client with no disease to treat.
Yeah.
We're also seeing an appreciation for the testing services at St. John's. And, at St. John's, we have a very strong policy, a strong test before treatment policy. And right now, I want to say that I'm happy that conventional medicine is being considered as the first option for treatment by very many people in the community, as opposed to what used to happen over 10 years ago. Yeah.
Yeah, it's so interesting. One thing that I've learned that is one thing to have a clinic and have people there and medicine and services, but it's also a big education component as well to help people understand preventative care and when they need to come in to access those services. Right. So thank you for that. But what health problems still persist in the community?
So malaria still remains the biggest problem. Just to give you a perspective of what malaria, is in Uganda. Looking at the statistics, over 90% of the population is at risk of getting malaria. When I look at the statistics at St. John's, 70% of all our clients that we treat have malaria. So that's a big problem for us. Yeah.
And why is that? Do we know what's causing that?
Well, so we are seeing an inadequate, supply or distribution of mosquito nets. There are negative perceptions by the communities in regards to community programs of spraying. We are seeing improper use of mosquito nets. Some communities are using some of these mosquito nets to protect their vegetable nurseries, so that chicken and birds do not, feast on their vegetables. But also as well, there are some communities that engage in fishing, so they use the mosquito nets to do fishing. We're also seeing a lot of breeding grounds. The community is not aware about how to manage, clearing the breeding, grounds, the bushes, and also draining water, which are very strong breeding grounds for mosquito.
So what can we at the clinic do about that? I assume a lot of it has to do with education again.
Yes. So there are two things that we are doing. First of all, at St. John's, at the health center, what we are doing is that we have programs distributing malaria mosquito nets to pregnant mothers, but also as well, any mother that comes with an infant for the first immunization shot. We also distribute mosquito nets so that they're able to protect their infant. We are also having free malaria treatment, simple malaria. So we distribute drugs to clients that have malaria. Then the other thing that we are doing in the communities is that we are doing a lot of health education, and we have a lot of community dialogue activities where we go to communities, we engage with them on how they can, first of all, understand that the environment is also one of the contributing factors towards the spike, the prevalence rates of malaria. And so how then can they be able to sustainably approach the environment in such a way that they are going to have, the breeding grounds for, mosquitoes, eliminated.
Yeah. That's great. That's great. So speaking of malaria and other diseases that really are bedeviling so many countries in Africa, we know that lately the landscape of foreign aid coming from the United States has changed drastically. There's a lot going on right now. We here at Give Us Wings are not directly affected by that because we do not receive any federal funding. So that's good. But I imagine you're probably seeing some effects in the Tororo area. Is that right?
That is correct. So Ministry of Health in Uganda reported that because of the cuts, USAID cuts, over 600 billion Uganda shillings was cut, which that is an equivalent to 163 million US dollars worth of programs for malaria, HIV, and maternal child health care, and many other health activities. At St. John's, we have a number of partners that we've been working with that have been affected. The AIDS Support Organization has been one of the instrumental organizations that has been supporting us in giving us the HIV testing strips, which are very expensive. First of all, the HIV testing strips, we use them to provide a comprehensive antenatal care package for the pregnant women. And so they also give us mosquito nets. So because of that cut, they were affected, and now we no longer receive these items. We've been also working with an organization called Health Partners Uganda, and which has been very instrumental in helping us to shape our community health insurance. And so we've always been sending reports to them every month since 2016. So right now, because of the cut, they closed down their doors, and we have a number of reports that we don't now have anyone to send to.
Yeah, right. Well, thank you for that information. I think it just underscores how uh, our support of Give Us Wings in Uganda and the clinic is more important than ever, because we can really hopefully fill in some of those gaps that are drying up in other places.
Right.
Yeah. So let's step away from healthcare for a minute. We don't have enough money to bring all four of our program managers over here, unfortunately. So you need to represent everybody. Betsy talked a little bit about education earlier, but maybe you can share a couple exciting things that are happening in the area of economic development.
Okay, so farmers right now, under our economic development program, are busy in their farms. We have very good rainfall, and we are expecting a bumper harvest since it's the first season of the year. So I think around mid-year, we're going to be having bumper harvests. Secondly, cooperatives are advancing very well in their various enterprises. For example, we have a cooperative called Osia Cooperative that recently received 4 tailoring machines. And so the women or the young ladies that receive these machines are busy at work, making money for themselves, but also as well to be able to sustain their households. So quite a lot of interesting things that are happening.
Yeah, that's so great. We're really excited to add four new. Whoops, look at that. 4 new women in our tailing program. So I think we're up to 14 now in that program as they begin their own businesses, which is really great. One of the things that we really stress in our economic development work is empowering women. Can you tell us a little bit about why that's important? What's going on in Uganda that makes that important?
So the role of a woman is very important, not just in Uganda, but anywhere else in the world. But just to go back to Uganda, it's very important to understand that women are very disadvantaged because, first of all, they do so much, starting from cooking, taking care of the children, when a child is sick, bringing them to the facility for treatment, and, going to the gardens, and, doing all water and firewood, getting, water to the homes from the wells, going to the forests to look for firewood to come and prepare meals for their families. So quite a lot of things that they do. Now, you would expect that the roles that they do would translate to the voice and, them being in position to be able to make decisions for their households. That is the unfortunate, thing. And so it's very important that Give Us Wings has realized this and has stepped up through the various programs. First of all, to ensure that these women, first of all, their voices are heard, not only just at their households, but the society, but also as well, we're empowering them with skills to be able to generate income, because we know that when you empower a woman, you've empowered a nation. When you educate a woman, you've educated the nation. So women are people that will always multiply because of their nature, And so Give Us Wings has taken a very big step, bold step, to making sure that women's needs come first. But also as well, we're working with the men.
Yes.
So that
right.
they're able to support these women, through the empowerment programs that we are having. So I want to just again stress that the role of a woman in the society is very, very, very big and important.
Right.
Yeah.
Yeah. So much comes back to education. And I think that's true about, we're working to empower women, we're working to give them self-confidence, we're working them to understand that they can have a voice in decision-making in their households and in their communities. But we're also talking more and more about educating men too, so that they can work in more partnership. So that's an exciting kind of area that we've just been talking about recently. Gosh, we could talk about that a lot. We're going to move on now and ask for a couple of questions from the audience. If anybody, we're going to put Anthony on the spot. If anybody has something that they'd like to ask. Yes, we got a hand up in the back there. Yeah, Sue.
You're so brilliant. After waiting so long. So I know it's your first time in the U.S. It's the first time in the U.S. What has surprised you? Is there one or two things that have really surprised you over the last couple of days that you didn't expect?
So yeah, there are quite a number of things that surprised me. Everything here is automated. Okay, for example, you go to the loo, the restroom. The toilets are very enthusiastic. you know, so I'm still trying to work my way around that. But the people are so nice, and the food is good. It's not bad. I had my first hamburger. It was quite a mouthful for me, but then I'm excited to be here. It's really an honor.
The people are nice and the toilets are enthusiastic. You heard it. You heard it here first. All right, one more here. Yes, Candy.
How long?
Kids in school.
Yeah, so we have primary school, which runs about 7 years in Uganda, and then we have high school, which runs about 6 years. That is ordinary level for 4 years, and then advanced level for 2 years. Then at university, we have a standard of 3 years, but it depends on the courses that you take. If you're to take a course in law, then you spend about 4 years. A course in medicine, you take about 5 years. Typical population. Okay, first of all, it's important to know that in Uganda, majority of the population stays in the rural community, rural area. So they really don't go too far with their education. Majority of them, I want to say, end at senior 4. That is high school, ordinary level. Yeah.
But especially for girls, to even complete senior 4 is still not that common. I think Betsy might have some more, some numbers around that, but it's not that usual for girls to get all the way through senior 4. Is that right?
That is correct.
Yeah.
The ladies are disadvantaged, unfortunately. Yeah.
Right. Right. I had one more, Emily, and then we'll, yeah.
I want to know if you're still playing in band.
Not really a band. Well, I used to rap.
Is there a wrap? That's another year.
So
Yeah, right, yeah, we'll do that later.
yeah.
Okay, one more.
Okay, thank you very much. First of all, I really want to thank all of you for supporting, for coming, for loving. Thank you so much. And Anthony, you're right. Americans are really nice. And I think the news doesn't do us good to say those things. I have too many questions, but I'll send them to Peter, really. My name is Dr. Joy Ngobi. I'm a professor at the University of Minnesota, and I'm Ugandan. So I'm from Jinja. Okay, so I just wanted to give you a little background. And I am a public health fanatic. So I'm going to ask a couple questions, okay? Peter and Anthony, you're great guys. And Give Us Wings is a great organization. I'm sitting here, and I run a nonprofit too. So I'm sitting here and I'm thinking, I know these are good people. Well, what will happen when Peter is not there and Anthony is not there? And maybe the grandchildren, I know you guys are all good people, but maybe you become a little weaker and your grandchildren don't buy into your dream. What happens to these people? What's your plan, like long-term plan? That's one question. You don't have to answer me right away. Number two, you could answer on email and send all your supporters. Number two, I love women. I'm a woman. And my mother had the attitude you guys have. Women are very important. We got to protect them. The girls get pregnant, we protect them. What happened to my mom, she was a teacher. 3 girls, we had the best education. So I don't even understand when people say girls are disadvantaged because my mom protected us so much. But the trouble is the boys were left behind. They were as smart as I am. So then they got into alcohol and every bad thing that is. What is your plan for boys? We cannot continue just saying girls only because unfortunately girls get married to boys who cannot keep up to these aggressive girls anymore.
Thank you. Thank you, Joy. Yeah, like I said, we have been talking a lot about some sort of program for men and boys because I remember hearing second time I think I was over there, somebody did say we talk about the girl child, girl child, girl child, girl child. When do we talk about the boy child? And so now I think maybe there's going to be a little bit of a I don't know backlash or something. So that is on our plans to talk about. Can we start some sort of program, a support group for men and boys that they can start to learn about being good fathers, being good brothers, being good husbands, things like that. So I don't know. Do you have anything more to say about that?
Well, about beyond you and me.
Yeah.
So, first of all, it's important to know that Give Us Wings is grounded on sustainable activities, so that past me and Peter, there can be a continuation of the programs, a continuation of the activities. Before I joined Give Us Wings existed, and I know at a certain point I will also exit Give Us Wings, that it will still continue to exist. And so Give Us Wings right now is very strong on ensuring that there are self-sustainable mechanisms. First of all, to ensure that there are resources coming in. We're working with a lot of partners in Uganda and also here in the US to make sure that we can be able to sustain our programs, and also, of course, leveraging resources. Yeah.
Yeah, that's very true. We work hard. We would like nothing more to not have to do this work anymore, right? To just be done. That's probably a ways off, but we are definitely working to not just put band-aids on problems, but to educate, train, so that people can lift themselves up and be independent. Yeah. Let's keep moving on here. A couple more questions as we wrap up. Anthony, can you just tell me what would you say your biggest challenge is at the clinic right now?
The biggest challenge at the clinic is we have a lot of high expectations for advanced services, like cesarean section. Right now, we're having very many ladies coming in requesting to have cesarean section done, and yet we don't have the capacity, we don't have the facilities to do that. So with the high volumes of clients coming in to give birth, it runs the risk that we're now going to have high-risk mothers refusing to leave the health center because we've referred them to the next level of care to access these services. So that's one of the things that we are still grappling with. But also,
sorry, can you explain that a little bit more? So they need to be referred somewhere else because we don't have the capabilities to do a C-section or something.
Exactly.
But they really want to stay at St. John's.
Exactly. They want to stay at St. John's because of the therapeutic environment that we offer, the friendly staff, the availability of the medicines, and just a quick response of, provision of medical care for them. Yeah.
So we're a little bit a victim of our own success here. That people have really come to love the services that we provide, the care that we give, and sometimes they want more services than we can do right now that we have the capability of.
Right.
Yeah. Well, that brings me to my final question, which is, what are your dreams for the future? As you think about the needs, what would you really like to have addressed in the next year or so at the clinic?
Okay. So again, if I go back to the data, the ladies that we used to give birth about 10 years ago, we used to get about one lady in a quarter, or even sometimes no. These days, we have hundreds of ladies coming in to give birth, and unfortunately, we only have one delivery bed, which has, worked over the years. Thousands of children have been born, and so we now need additional delivery beds, at least 2, so that we're able to at least meet the current demand of delivery services at St. John's. The other need that we have is we now need more space where women cannot be able to give birth. The current space that we have can only accommodate one, and we don't have any other space. So we now need an additional delivery space so that we can have multiple deliveries happening. We are grateful that last year but one, we started off with the modern laboratory that I see here. which has a number of facilities, wider space, so we don't run the risk of having our clients and also as well the medical staff getting infected. We have a specimen collection room. We have a store where we can keep our equipment. So right now what we need is medical equipment for the laboratory. For example, we need a complete blood count machine to be able to detect anemia, immune system disorders, and infections. We also need to have a centrifuge machine so that we are able to have the different blood components separated.
Separated.
Yeah.
For
Yeah.
for testing purposes and
Testing purposes.
Nice. Right, that's great. That's great. Well, we will definitely be working in the months and years to come to continue to advance the clinic and the services that you can provide there. Thank you so much. Anthony, it has been such a joy of mine to get to know you over the past 3 years. It's super exciting to have you here and to know people here to get to know people in Minnesota. We're so happy to have you. We need to keep moving on, so keep your question because Anthony's going to be here all night afterwards, so he'll keep talking to whoever wants to talk to him. So do you have any final words to say?
Yeah, I just wanted to say that it's an honor to be here to give a reflection of the work that Give Us Wings does and the impact that it has been able to create over the years through health, through education, through economic empowerment programs. And so I just want to appreciate each and every one of you for taking time to come and be a part of this noble activity. And we really hope that it's going to be a successful night, not just today, but we shall have a continued success in how we are able to continue furthering the work that we are doing in Uganda. And I just want to thank all of you, and I'm happy to be a part of Give Us Wings and all its accomplishments. And I'm really looking forward to having an interaction with all of you. Thank you.
Thank you so much, Dr.
Yeah, it is you. Thank you. Thanks so much. Thank you.